I Understand.
Multiple sclerosis, or MS, involves an immune-mediated process in which an abnormal response of the body's immune system is directed against the nerve cells of the central nervous system, so the brain and the spinal cord. The exact antigen, or the target that the immune system is sensitized against or meant to attack, is unknown. That's why the MS is considered an immune-mediated response rather than an autoimmune response. But what happens is that there will be damage in the central nervous system itself. So the myelin sheath, that layer of fat that covers the nerve cells, will be destroyed or damaged. This myelin sheath insulates and surrounds the nerve cells and the nerve fibers, and this has a very important function. So the damaged myelin forms a scar, and this scar is called sclerosis, which gives the disease its name, multiple sclerosis. So sclerosis, hard scars in many areas of the nervous system. When any part of the myelin sheath or the nerve fiber is damaged or destroyed, the nerve impulses traveling to and from the brain and the spinal cord are distorted or interrupted. And this will produce a wide variety of symptoms. The disease is thought to be triggered in a genetically susceptible individual by a combination of one or more environmental factors. People with MS experience different disease courses, which can be mild, moderate, or severe. The first symptoms happen between the ages of 20 and 40. Some symptoms may come and go, while others stay. The disease has a course described as having exacerbations and remissions. So there are ups and downs. Keep a diary or a record of your symptoms to help your doctor recognize the disease course. MS doesn't have to control your life. You can manage the symptoms and you can stay healthy if you know how. There are early symptoms and warning signs of MS. They're mainly blurred or double vision, thinking problems, clumsiness or lack of coordination, loss of balance, numbness, tingling, weakness in the arm or a leg. And no two people have exactly the same symptoms of PMS. So you may have a single symptom and then it will go away for a month or a year, or maybe never come back. The most common symptoms of MS are the unusual sensations. So the patient will feel pins and needles on the skin. You may also have numbness, itching, burning, stabbing, or tearing pains. The bladder and the bowel will suffer also. You may need to pee often or need to go at night or have trouble emptying your bladder fully. There will also be bowel problems, especially constipation. You might experience trouble while walking. So the MS can cause muscle weakness or spasms, which make it harder to walk. There will also be balance problems, numb feet, and fatigue. Dizziness is also a common complaint. It's common to feel dizzy or lightheaded, so be careful. Maybe walking with some support will help you. Most MS patients feel tired during the day, and it's usually not related to the amount of work they do. There will be also sexual trouble, unfortunately. This will include vaginal dryness in women and erection problems in men. Both men and women may be less responsive to touch and have a lower sex drive, or have trouble reaching orgasm in general. There will be also speech and swallowing problems. There will be pausing a long time between words and having slurred and nasal speech sometimes. Swallowing may be a problem as well, so be careful if you're a patient or your family has to be knowing how to save you from choking. You might experience slowed thinking, poor attention, or fuzzy memory. MS usually does not change your intellect or ability to read and understand. The tremors that you could experience can be minor shakes or very hard ones and might make it hard for you to do your daily activities. There could be also vision problems. Your sight might be blurry, gray, or have dark spots in the center. You may suddenly have eye pain or temporarily vision loss. Because MS varies so much, it's best not to compare yourself to other people with the same diagnosis. Your experience is likely to be different. The treatment of MS includes different lines that come together to make your life easier and better. You will have medications, also assistive devices like walkers and wheelchairs, physical therapy, speech therapy, and surgery. But I'd like to address you especially about the lifestyle treatments of multiple sclerosis. Although diet is not currently considered a causative factor in MS, there is an anecdotal evidence from individuals with MS who have experienced health benefits of changing their diet. Cutting down on red meat and dairy foods can be positive and very good to your MS course of events. But you would need to find an alternative source to provide you with protein if you cut down on meat. So you will have to eat more beans, pulses, nuts, and sometimes fish. Vitamin D supplements have been shown to be very beneficial to the immune system. A clinical trial is underway to determine what vitamin D supplements, what their role is in reducing the MS disease activity. Because the myelin sheath is made of a fat layer, omega-3 fatty acids have been the focus of MS studies recently, with some evidence pointing at the benefits of relapsing and remitting MS. So I'd say give it a try, but ask your doctor for advice first. MS is neither contagious nor fatal. People with MS have a life expectancy that is not really any different from general population. So let's just go and face MS. I wish you the best of health. This video contains general information about medical conditions. The content might not be suitable for everyone and should not be treated as such. Always consult your doctor before using medications. The medical information is provided without any warranties or legal obligations to those who might apply them.